I'm the nurse that's been working with you today. I have your discharge papers ready for you.
Thank you.
So one of the most important things that I want to get across with a person with your types of incisions and your PICC line is hygiene, because we want to prevent infection, especially in the post-operative period. So the number one way that we can do this is by teaching you how to do proper hand hygiene and to teach you the signs and symptoms of infection.
Okay.
Do you have any questions before we begin?
No.
Okay. So some of the major signs and symptoms of infection that we want you to look out for are as follows. The first one is a fever of over 100.4. And so you're going to be taking your temperature every morning to make sure you're not getting a fever. Also, around both of your incision sites, if you have new swelling and redness that you notice in either around your PICC line or your abdominal incision, that can be a sign of infection as well. Another one is new pain or leaking and drainage around those two incision sites. And lastly, if your PICC tubing starts to pull out, that's when you will need to call your doctor or surgeon, because those are bad signs. Would you be able to tell me some signs and symptoms of infection?
Sure. First, if I have a fever over 100.4, I'm supposed to take my temperature every morning just to double check that. If I have any swelling on my PICC line or around my incision, if I have any leakage or drainage around either my incision or my PICC line, and if my PICC line pulls out, and also if I have any swelling around either site.
Yes, that's correct. So do you have the numbers of who to call? Like, do you know who to call when now?
Yes, I have my doctor's number and my surgeon number on my discharge papers.
Perfect. So when you see those signs and symptoms of infection, make sure you call them and they can work with you to see what your next steps will be.
Okay.
So the number one way, as I said earlier, to prevent infection is practicing good hand hygiene. So before you get discharged, we're gonna go over to your sink in your room and I'm gonna demonstrate how to do proper hand hygiene, okay?
Okay.
All right, so let's go. And so we have this soap and everything set up. So you wanna wash your hands for about 30 seconds, which is the happy birthday song 2 times. So I'll demonstrate and then you can do it after me, okay?
Okay.
And I know it might seem silly, but it's very important. So you're gonna wash your hands first. When you go up to the wrists, get it between your thumb and all of your fingers, as well as scrubbing between your nails like this. Just make sure. And this is especially important to practice in your daily life, as well as anytime you're about to touch anything around your PICC site, and especially your abdomen, because by getting rid of these germs, you will really be able to prevent your signs and symptoms of infection. And so you also don't want to use dish towels to dry your hands. You'll want to use paper towels because dish towels will be a little bit more germy.
Okay.
So as I dry my hands, would you be able to demonstrate how you're going to be washing your hands?
Sure.
And here's a new paper towel for you.
Thank you.
And now we can finish the rest of your discharge paperwork. Do you have any questions about hand hygiene and infection control?
No, thank you.
All right, thank you so much for listening. We can talk about this more.
Okay, thanks.